Chemotherapy is what people think of when they know someone has cancer. They're like, oh, they're going to have to get chemo for short. And everyone knows it to be fairly toxic, and patients usually have significant side effects.
Chemotherapy are chemicals that affect rapidly dividing cells.
There are a lot of different types of chemotherapy, but the drugs themselves, they target the different parts of the cell cycle and the ability for the cell to grow and divide.
Because cancer cells are more likely dividing than not, the chemotherapy is more likely to kill cancer cells than healthy cells. Cancer cells are not the only rapidly dividing cells in our body. Your hair is constantly growing, or the cells that are lining our GI tract, our colon, those are also rapidly dividing cells, and those can sometimes get caught in the crossfire.
And so a lot of the side effects that you see from chemotherapy, hair loss or diarrhea, vomiting, is because those cells, your hair follicles and your cells lining your gut and your mucosa, those are also cells that divide very fast, just like cancer cells. The chemotherapy drugs aren't able to differentiate between what's cancer and what's normal. Another issue in treating and preventing cancer is that many aggressive cancers evolve to evade one type of chemotherapy known as treatment resistance. So if you treat with one chemotherapy drug, they're going to figure out a way to stop that drug from interfering with their ability to divide. And that's what we call treatment resistance. In the early 2000s, new combinations of chemotherapy were developed that showed improved response rates and life expectancy. So that's why usually we'll treat with more than one at the same time, because that ultimately is harder for the cells to overcome.